So, dear colleague, dear Osama, welcome to Endo Dubai 2021 and to this excellent section about hot topics in hysteroscopy. I am really very pleased to Osama for this opportunity because it gives me the opportunity to say why I decided to make the shaver almost 30 years ago. And actually, the idea of the shaver came after a workshop made in Bonn almost 30 years ago. It was 1992. During this workshop, I saw a live perforation during an operative hysteroscopy, and that's why I started thinking about an alternative methods to do operative hysteroscopy. So the idea to make the shaver was to make a new device which was much safer for the patients and easy for the surgeon. So I don't say that we should not use any more resection. I believe that resection should be always used as a second line procedure. So you should first approach the majority of the pathology with the shaver, and when you cannot use the shaver, then you have to use the bipolar receptoscope. So the title of my presentation is the shaver technique. Why? So let me explain why I think that the shaver technique should be the first choice procedure and in operative hysteroscopy. So I believe that the shaver is a good device because it is very easy to use, it's very fast, it's very safe, it minimizes trauma, and is the best choice for infertility patients, and in the end it's also convenient. So let me start to say why I think that the shaver is easy and fast. First of all, and this is the main reason why the shaver is easy, is because the shaver is able to remove the tissue chips at the same time as you do resection. And this is the key point. By doing this, you increase your visualization. So you always have the view of the cavity, of the pathology, and you never lose your visualization. That's the main important reason. So in second is that when you enter with the shaver, you should not go out until you finish the procedure. So no in and out movements are involved. And in the end, with the development of the 19 French shaver, there is in the majority of the cases no need of dilatation. So let me show you this polypectomy down with the shaver. So we are talking about a large polyp, pedunculated polyp in the posterior wall. You see you enter with the blade, you check that the blade is working. Always remember to check under visions. You go on the top of the polyp and you start the procedure. It's important that you use a suction of 250 milliliter per minute on the Endomat LC at a speed around 2100 per minute, rotation per minute, which means the oscillating movement made by the inner blade inside the outer tube. As you see, you go on the top, you just activate the blade and you reach the base in a few seconds. So a polypectomy in the majority of the case lasts only a few seconds. So with the 24 French shaver, actually you need more time to do the dilatation than to finish the procedure with the shaver. With the 19 French shaver, of course, you don't need to do any dilatation anymore, so you are much faster, and in most of the cases probably you don't even need any kind of anesthesia. So why the shaver is safe? First of all, because it's a mechanical resection, so you don't involve electricity. So you have no electrical loop inside the uterine cavity, which is, if you think, to have a free loop inside the uterus is a really very dangerous situation. So you really need to be a very good and trained hysteroscopist to use the resectoscope. I've been trained with the resection, so I know what resection means. I'm not saying that I did the shaver because I'm not able to use the resection. This is wrong. I've been trained with the shaver, with the resection. Me, Rudy Campo, we did many courses around all Europe to train people to use receptoscope. So we know exactly how a receptoscope is. So first of all, it's safe because it's a mechanical resection. Because we do not make any bubbles while we do resection with the shaver. So you know that with bipolar receptoscope you create bubbles, even if there are bubbles which are well absorbed, but you cannot recognize which bubbles are coming from the fluid bags from the bubbles you create by yourself. With the shaver, because you are very fast, you need to have a very mild, or in case of the night in French, no anesthesia. So you reduce also the risk of the anesthesia. And in the end, I can really say that the resection is fast in the majority of the cases. In almost 90% of the cases, you are really very fast. That's why the shaver is safe. So let me show you this case of placenta remnants. This is a very interesting case because the placenta remnants were based mainly into the cervix. They were not inside the uterine cavity, which makes the procedure even more difficult with the receptoscope. By using the shaver, there is no heat inside the uterine cavity. You remove the placenta remnants quite easily. The bleeding, in this case, because we had the opportunity to wait at least more than 60 days before approaching these placenta remnants, you see the bleeding is very, very little. You can really shave the surface of the endometrial layer, and you can remove all the placenta remnants. Which is interesting in this case is that the placenta remnants were very close to the scar of the previous C-section, because these placenta remnants were left after a cervical C-section made for a cervical pregnancy. After almost 3 months before this procedure. So you see we removed all the placenta remnants in a very careful way, always looking at what we were seeing. This is the amount of tissue which has been removed. So the procedure lasted about 25-30 minutes. It was quite a long procedure because the tissue we removed was really a lot. So very safe procedure. So these are all the type of intervention we have been made since I started to develop the shaver. As you see, we did almost 2,000 cases, and the majority are benign pathology. 81% are polyps. The rest of the indications are also successfully performed with the shaver in one-step procedure. So you see the myomectomies are only from 10 to 15% of all the indication. If you consider also some myomas can be performed, at least 50% of the myomas we perform with the shaver, so you see that the indication is correct to say that more than 90% of the cases can be approached with the shaver in a very safe way. So the complication rate on 2,000 procedure is almost close to zero. This is just a slide to show you our activity in the center of Shanghai. The Shanghai center was open in August, so since we reported these 4 months of activity, we did almost 1,500 procedures. 660 were shaver procedure, the other one were just diagnostic, but you see that on 660 procedure we did only one resection, and actually this resection was on an adenomyosis and not on a myoma, without any kind of complication. This also slides show our work in the center in these 4 months. You see that there has been an increase in the diagnostic procedure and in the operative procedure. Another thing The third point why we think that the shaver is you should choose the shaver, because the shaver minimizes trauma and is excellent for infertility patients. You have no thermal injury inside the uterine cavity because you don't eat like you do with the receptoscope. You respect the healthy endometrium because you just work where the pathology is. You don't touch the healthy endometrium. You respect and preserve the tubal ostia because you have no thermal damage. If you go with resection close to the tubal ostia, you might damage the tubal ostia, and then of course you impair fertility. And also, because you are not using any form of electricity, so no heat, you do not make any damage to the fibrinolytic system because you don't leave any ischemic stimulus inside the uterine cavity, so you create less adhesions, less post-operative adhesions. So that's why we think that the shaver is excellent for this. The shaver minimizes trauma, and of course you can minimize trauma by avoiding the DNC after abortions, by preferring medical management of miscarriages, but anyhow you have placental remnants even if you do the medical treatment. And what is important by using the shaver, that you reduce the thermal damage at operative hysteroscopy. This is the key point of the shaver use. On the other side, you can increase endometrial regeneration, and we think that by using the gel instead of the IUD or the balloon catheter, you do you get this effect. So minimize trauma. We believe that the mechanical way of approaching the uterine pathology is the best in order to minimize trauma. It is less traumatic instrument you can have. On the other side, you can increase endometrial regeneration by using gel. This gel actually is a modified hyaluronan gel. It's made by a Chinese company. It's called Mate Regen Gel. It stays inside the uterine cavity for 14 days. It keeps the wall of the uterus separate for 14 days. And in addition, it has the advantage of modulating inflammatory response in order to facilitate scar-free tissue repair. The last point about the shaver is that the shaver is convenient. The shaver is completely reusable, so once you get the shaver set up, you can use it forever. So the initial cost will be soon returned. And on the other side, you have the fact that these instruments are very strong. The optical system is is of very high quality and also very strong. So you don't need many things to assemble it together. It's very easy to put it together. So even the nurses, they prefer to use the shaver compared to the receptoscope. And of course, you have to consider that the blades have a very long-lasting life. So it's very difficult to break a blade. Remember, you are not cutting and you are not removing the pathology because the blades are sharp. Sharpness is not involved in the functioning of the shaver. Is the movement of the shaver which allows you to remove the pathological tissue. So let me show you this interview which was taken during by the Chinese by the Shanghai International Channel.
He's the first foreign doctor with a full-time job at a state-owned hospital. Reporter Zhang Yue tells us more about the Italian.
The intrauterine Bugatti shaver, or IBS, is a tool doctors use to examine and treat the inside of the uterus. It's acknowledged as the safest and most precise instrument in the field of hysteroscopy, and was invented by 58-year-old Italian doctor Giuseppe Bugatti. Bugatti works as the director of the Sino-European Life Expert Center at Renji Hospital, focusing on intrauterine diseases, which are common among women between 40 and 50 years old.
You're always afraid to try to keep the pressure down. This technique is very good for patients who are searching for kids. All operations here are done on a day surgery base. Not an operation, no anesthesia, nothing. For the operation, they come in the morning and they leave by 12 o'clock.
In late January, when the COVID-19 outbreak emerged, the Italian refused to abandon his patients and return home. In February and March, the center had to shut down temporarily to reduce cross-infections. Only emergency surgeries were permitted. Bigatti volunteered to join the fight against COVID-19 in Wuhan, but his offer was refused because there was no demand for medical workers specializing in gynecology and obstetrics. So Bigatti made full use of the time to prepare the new center, which opened last August.
We had all the time to prepare the center, the building of the center, and also the training of my doctors.
With more advanced instruments and updated equipment, the center is doubling the number of surgeries.
We plan to do at least 20 diagnostics per day, which means 40 operations per day, which is 200 per week.
Bigatti says China has advantages for research in intrauterine diseases, thanks to patient numbers based on its population. However, the center's aim is not about the quantity of work, but the quality.
We are fast, we are very precise, we give quality to the operation, especially for patients, for infertile patients.
Bigatti and his wife have been living in Shanghai for almost 2 years. And what Bigatti loves most is traveling in China.
We've been to Shenyang, Shenzhen, and also to Shijiazhuang. Another place very interesting is Harbin. And also to Tianjin, because Tianjin, which I miss now, I know, is somewhere here. And Tianjin, because there is a part of Tianjin with a lot of Italian remainings. Some Italian soldiers were in Tianjin until 1945, until the end of the Second World War. Then they had to leave. Concessione, it's called Concessione in Italian. Another place which I would like to go is to Urumqi.
But as Shanghai has become their second home, the couple do not feel homesick.
Shanghai is the most beautiful city also in China. I really feel at home. It's a strange sensation, but it's true.
I should say that the pizza that you have in Shanghai is much better than the pizza that we have in Milan. This for sure. You can live the Chinese way or the Western style. We like the Chinese style, but we also like our style, so we have the possibility to do the same things that we do in Italy. This is for you after.
Bigatti, who originally only planned to work in Shanghai for 2 years, is considering renewing his contract for another 2 years. He says he hopes the pandemic ends soon so that he and his wife can fly back to Italy to visit their aging mothers. Zhang Yue, Shanghai Live.
So, I just wanted to share with you, especially with Osama, with my friend Osama, this video, because it really shows that, and it proves that the shaver is not only the present, but is also the future. It is the present because we actually use the shaver on a daily basis in Shanghai with a lot of numbers. So it's, on my point of view, is not only the present, but will be also the future of operative hysteroscopy. So I would like to thank always my friend Rudy Campo, with whom we share the same concept in Leuven, and also my friend Yves Van Belle, whose genius will stay forever in the world of hysteroscopy, and all members of the Rollerball team. Thanks once again for your attention. Thanks to Osama for this great opportunity, and I hope that there will be a big discussion today about the shaver, and also to Arnaud for this great opportunity of Endo Dubai 2021. Thanks again for your attention.